Awesome. So Avant is a very unique clinic in that it's a personalized concierge urology clinic. We want patients to feel individualized, special. We want to focus on patient care from a patient viewpoint. So I've always felt that bigger is not always better. We just want to focus on delivering high quality care centered around the patient. And that's what really Avant is focused on. What is unique about Avant Concierge Urology and our approach is we provide a blended approach. We take insurance, but we also push for concierge care or self-care or self-pay models. In this day and age, it really allows physicians the freedom to focus on quality care rather than meeting certain targets or meeting certain criteria set by insurance companies. So I feel that the concierge model gives us freedom to really deliver care the way we want to, which I think is fundamentally what we all want. So the treatment is really centered around patient comfort. So what we do initially is we'll numb up the skin in the perineal area so that you don't feel any pain. And then we'll especially or carefully put in these small catheters basically to hold the laser. And that's the catheter or the laser fiber that will then kill the tissue where we place the catheter. So essentially a very comfortable, quick, effective treatment where we can ablate the cancer and preserve function. Overall, the whole process or techniques takes anywhere from 20 to 30 minutes, sometimes a little bit longer if we're doing both sides, but if we're doing just one side, usually it's under 30 minutes. What's also unique about the CLS system is that it's very quick, efficient, portable. It's such a compact system that really ideally suited for the office setup. Between procedures, cleanup, setup is really quick and easy. Allows the physician to run out. The nice thing about doing the office-based procedures allows the physician to run out and see other patients in clinic. Routinely what I do is I'll do a procedure, but I'll have other regular patients, whatever I'm doing in another room or another procedure room, so I can do a number of things sequentially and just jump from room to room. So really allows for improved office efficiency and delivery of care. So I really believe that the CLS Tramberg treatment option is a really effective treatment option for patients. It's great for the patients and for the physician. Number one, it works well, there's great clinical outcomes, minimal side effects. And then for the physician side of things, it really empowers physicians because it allows us to deliver care in an office setting. The beauty of this treatment option is that once a patient signs up for this, literally you could set this up within a few days, a week or two, just based on your schedule. So it really allows the physician to deliver high quality care on the physician's timing and convenience. CLS really makes it very, very easy for the physician from the beginning to the end. Pretty much you just rent out the equipment, technician comes in, they set everything up, so the physician really just gives the approval for the planning and the treatment. And if you're comfortable doing transperineal biopsies, the technology is very, very similar. So really just uses real-time ultrasound or MRI based on what equipment you have in the office, but really is very, very simple. And I think CLS has set up a really beautiful delivery mechanism where it makes it simple for the physician.
Following the procedure, I had virtually no discomfort from the procedure itself. I took a little bit of Tylenol, just basically heading off any swelling in that. I'm pretty much side effect free at this point. I had minimal side effects before the procedure as far as retaining urine and not being able to empty my bladder completely, and now that following the procedure I seem to be functioning much better.
Yeah. After the procedure it was really night and day. He would always call me before, and we joke about, he's in sales, I'm in IT, and he's telling me I'm always taking naps during the day. Well, he really was beforehand. And after this, no naps, the energy levels have increased greatly. And another big difference is he's probably gained 20-25 pounds since, the procedure. Yeah.
Yeah.
So.
That's great.
Yeah, that was special for sure. As soon after I got the prostate laser ablation cancer treatment, 1 week later, I'm back to work, and a week or so after that, I got the green light from Dr. Pericottle to be able to exercise and do what I want. Consequently, why I'm talking about that is because right thereafter, my oldest son, his son, my grandson, and my youngest son, all played in the golf tournament, a benefit golf tournament, and we won first place. And there was some great golfers there, and of course I'm the D golfer, but my son can attest that I showed up, I played well, and it kind of made the whole thing that much better, because I felt great, I was able to exercise and get better. So yeah, that's cool stuff.
So far, the clinical data so far in our series of patients looks very promising. We're batting at close to 100% in terms of cancer control. Obviously, it's early data and a small sample size, but so far we haven't really had any failures after treatment focal ablation. We've been able to effectively treat the areas that the cancer is in. If we've had any recurrences or pseudo failures, if you label that as such, it's really just occurrence of disease on the other gland or other location. Minimal side effects, especially when we're doing focal ablation on one side. We've never had a case of anybody having any incontinence or erectile dysfunction. CLS is very effective, very great company to work with. They make it very simple to set up the procedure and also to set this up in the office for you. If you have any questions, feel free to reach out to CLS. They're very approachable, and we'll be able to set this up for you without much difficulty at all.